RSV Academy. Questions about RSV. Severity of RSV infection and how to avoid it.
Hi everyone, I would like now to go with you briefly on the common risk factors associated with RSV infection and severe RSV infection, and the reason why RSV is considered important for prevention and what we can do for acting in adults, particularly in elderly patients, to prevent the infection and the consequences. Here is just a reminder of how frequent it is at all ages RSV infection and how severe it can be, particularly in hospitalized patients with a non-irrelevant mortality of more than 5%. Risk factors are considered exposure and immunological response of the patient, which articulates into elderly patient with immunosenescence and clinical condition associated with impaired immune responses, chronic inflammatory disease, immunocompromised patient. For the exposure, subject exposed to children that might be infected and transmitted, or the other way around, and nursing homes, as for any infective disease, are conditioned at higher risk of exposure. In terms of immune responsiveness, or the other way around, lower immune response that favor generally favors infection, and in this case in particular it favors severe clinical expression of the infection. Age is well known. The higher is the age, the greater is the risk of severe RSV associated infection, leading, for example, to hospitalization in different cohort studies. And comorbidities, chronic respiratory inflammatory disease, but also cardiovascular and metabolic condition, all of them are associated with some immunological defects that, added to the immunological deficiency associated with elderly condition, immunosenescence, makes them particularly vulnerable to severe clinical expression. Immunosenescence has been studied very deeply. This is a specific for RSV, but it's general mechanisms. All the immune mechanisms do decrease with time, and this is a particularly relevant issue, both if we consider the frequency, the severity of the infection, and in terms of prevention, because we need to implement somehow the capability of the system to respond when exposed to the antigen. So immunosenescence on one side, and concomitant condition, which clinically is very relevant, because thinking from a clinical viewpoint, what we see are patients, so subject with a condition. These are chronic conditions. In this case, I'm thinking of the respiratory one, but we'll see that they are not only respiratory. If we consider hospitalized patient with RSV infection, the most frequent cause of death, which means the organs that in patient infected are leading to insufficiency and eventually direct cause of death, are primarily respiratory, pneumonia, COPD exacerbation, cardiovascular, elderly patient, and concomitant superinfection. That is in line with the fact that these patients have an underlying immune deficient system. Looking at more in detail, these are different cohorts of hospitalized patients, and we'll see that in hospitalized condition associated with RSV infection, having COPD, asthma, cardiovascular, chronic condition increase the likelihood of being on that condition hospitalized with an RSV infection several times, 6 to 13, 14 times more likely to be hospitalized with an RSV infection having COPD, for example, of asthma compared to not having it. In COPD, the most frequent expression of an RSV infection is a COPD exacerbation. 83% of the clinically relevant infection of RSV in COPD patients do express themselves as COPD exacerbation. Only a minority literally have upper respiratory tract infection when it becomes clinically relevant. Why am I focusing on exacerbation? Because exacerbation in COPD are a crucial event in the natural history of the disease. Beyond the acute event, there is no clinical outcome in COPD that is not affected by exacerbation, starting from the cost of the disease, the increased risk of future events, the progression of the disease, the worsening of health state and unstable condition up to mortality. And again, I'm not referring to mortality in the acute event, but exacerbation do increase the risk of mortality and decrease life expectancy in COPD patients. That's why exacerbation are so central and crucial, and not only related to respiratory condition. This is what happens after an exacerbation. All type of exacerbation or severe exacerbation requiring hospitalization, there is an increased risk up to 1 year, particularly high in the first 30 days for cardiovascular events, from myocardial infarction to cardiovascular death. That's why preventing exacerbation, preventing the possibility of a trigger viral infection, RSV, to lead to an exacerbation is so crucial for chronic respiratory conditions such as COPD. The good news is that it's available now. This is one example of the efficacy of one of the vaccine that is becoming available, RSV prefusion candidate with adjuvant. The efficacy overall in terms of lower respiratory tract disease, which include the severe one that we consider as exacerbation of COPD. And in fact, the primary endpoint was the lower respiratory tract disease condition. It's even more effective considering the severe one, and this is particularly relevant for a clinical viewpoint, the very at-risk population, patient with pre-existing comorbidity of interest, respiratory and cardiovascular, metabolic as well, elderly patient 70 to 90, those where the immune response is lower and in higher need of being protected, the frail patient, pre-frail in this case, because frail were just a minority of the population, those that would go for worst outcome once the infection is there the protection is extremely high. That's the good news. We have something now to prevent the consequences, not only the event, but the consequences of the event led by RSV in adults.